As recently as the early 1980s, roughly 75% of doctors in the U.S. worked for themselves, owning small clinics. Today, that same percentage of physicians are employees of hospital systems or large corporate groups. Some physicians worry that trend is taking a heavy personal toll and leading to diminished quality of care. As Fred DeSam Lazaro reports, doctors at one large Midwestern health provider decided to unionize.
Hours before sunrise, Kate Martin shepherds her daughter to the ice rink. While her daughter perfects her balance on the ice, Martin uses the time to seek her own work-life balance.
Currently, I have about 86 things in my in-basket.
For family practitioner Leah DeVore, the best time to catch up with backlogged work is after her small children are in bed.
It'll depend on my kids, whether or not they wake up and come down or cry or the baby needs a bottle.
For many primary care clinicians, work stretches far beyond clinic hours. Notes from appointments, lab results, medication orders, messages from specialists. For some, it's reaching a breaking point.
Hello, everyone.
On this recent morning, Martin, a nurse practitioner, and colleagues, doctors and physician assistants, all employed by the Allina Health System, gathered in an unfamiliar setting, the Minneapolis offices of the National Labor Relations Board.
How in the world are you guys pulling this off?
Here to witness the ballot count in a historic vote to form a union.
We can't rely on corporations, we can't rely on healthcare executives to do the right thing for our patients.
Dr. Matt Hoffman, a leading organizer of the drive, says primary care providers have borne the brunt of a relentless drive to squeeze profits by increasingly large corporate owners, all at the expense of patient care. His employer, Allina, is a $5 billion a year health system with 60 primary and urgent care clinics across the Twin Cities area and nearby Wisconsin communities. Hoffman says that the problems here are hardly unique.
You could go to any city, you could find a health system. The same issues exist. The main problem is we have so much paperwork, so much administrative work that really isn't about delivering care to patients. The victims of that are really the patients we see. It's waiting on hold. It's not getting to see your normal doctor. It's having to see someone that doesn't know about you.
This is kind of going to be our waiting area.
Pediatrician Jennifer Mamel said she'd had enough and took an early retirement from Allina to strike out on her own.
That's what I'm going to do.
With a psychotherapist colleague, she was just settling into a new, small clinic above a St. Paul strip mall targeted at adolescent patients.
I have the luxury of controlling my own schedule. I can spend the amount of time I need.
She began her career in a provider-owned group, which was later bought by Allina. With the merger came centralized scheduling and standardization in everything, from how much time is spent with each patient, even to hand sanitizers, she says.
They were putting them all at kind of waist level, right? So you came in the room, and I went up to the fellow doing it and said, you know, this is the pediatrics department. How about if we put them up a little bit higher? Because I could see kids really enjoying these. He said, no, I've been told they have to all be at this level. A week later, of course, they had to come and move them all.
Dr. Hoffman was among those who protested an even graver policy at Allina, one they took to the New York Times. The policy instructed staff to stop providing care to patients with more than $4,500 in overdue bills, going beyond the more common practice of turning over such debts to collection agencies.
Did you have personal experiences with patients that you could no longer see?
Yes, absolutely. These are the patients that really need the care the most, people that can't pay their bills. A lot of these people are children.
Allina announced it has since discontinued the policy. The company declined to be interviewed for this story, but in a statement said, quote, while we are disappointed in the decision by some of our providers to be represented by a union, we remain committed to our ongoing work to create a culture where all employees feel supported and valued. When all the ballots were tallied, the 500-plus providers voted 2-1 in favor of the union.
What do you expect if you get to the bargaining table? We need more staff. We need better paid staff to help support us so that we can spend our time in the exam room with patients. We need help with our paperwork, with the administrative tasks, so that we can focus on patient care. That's really what we're looking for.
Things have to be pretty bad, I would argue, when physicians do try to organize, because This has never remotely been a part of their professional culture.
And Paul Clark, a professor of labor and employment relations at Penn State, says the doctor's vote is hardly the final chapter.
Your guess is that we won't see a contract between Allina and this group of doctors anytime soon.
If there was, it would be highly unusual. And they've sent a signal that they're going to fight this. They've hired one of the top anti-union law firms in the country and paid them a tremendous amount of money.
The same law firm has represented Starbucks, he notes, where employees at more than 300 outlets have voted to unionize over the past 2 years. Not one has reached a contract.
The strategy is delay, delay, delay. If you can delay signing a contract for a year, then there's a provision in the law that allows the workers to basically reverse their vote. It's called decertification. Workers expect a contract that's going to improve things. The hospital delays, a year goes by, the employees there are saying, well, we're not getting what we thought we'd get. We're paying dues and we went to all this trouble and it's not producing anything.
On the other hand, he says physicians do have more leverage and less job turnover than baristas. And the vote comes as a recent Gallup poll showed a majority of Americans, 71%, approve of unions, the highest level since 1965. Whether these doctors get a contract and how far, if at all, the Allina model spreads, Clark says, may become clearer in a couple of years.
Solidarity!
For the PBS NewsHour, I'm Fred DeSam-Lazaro in Minneapolis.
And Fred's reporting is a partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.